Hey guys, Dr. Tom Chaney here. In this video, I want to talk about the question that I hear all the time and the feedback I get from patients, my type 2 diabetics and pre-diabetics, that have been told that their condition is genetic. And I want to bring this up because when somebody tells you that a condition is genetic, how does that make you feel? I know if somebody tells me I have a genetic disease, it would make me feel like I had no control over it. So what I hope to do is, number one, tell you that clinically what I've seen is I've seen a lot of patients come in. I've seen most of these patients, they have a long family history of this disease. And number one, it hasn't affected my ability to actually help these patients improve their health, improve their A1C, and improve their diabetes. So I want you to know that. Now, there's definitely genes that are involved in, for example, the production of insulin. But there's also this whole field of epigenetics, which tells us that our genes are not set in stone. They're going to be expressed by how depending on what we expose them to. So if we're living a healthier lifestyle, so of course, they're going to express themselves in a healthier light. So don't let that be your destiny. The other thing is, when a patient is told that their condition is genetic, the first question that pops in my mind is, was there any genetic testing done? And I'd say probably 10 out of 10 times, the patient was not tested at all. They didn't have genetic testing. So therefore, that's just really an opinion given by that provider or that person. You can go online and you can Google, and I'm online right now, and you're going to see mixed opinions when it comes to diabetes and is it genetic, is it environmental? You're going to see some opinions that say yes, it's genetic. You're going to see other opinions that say it's environmental and lifestyle. In my opinion, and clinically what I've seen, it's primarily environmental and lifestyle. The other thing about genetic testing, I've got a paper up right now. This is on NIH's website. It basically states, and this is a whole research paper, and the conclusion is at present, genetic testing cannot be recommended clinically for type 2 diabetes in the risk prediction for type 2 diabetes in adults. They're saying that even the testing to see if it's genetic or not for type 2 diabetes cannot be recommended because it's not reliable and it's not valid. So I hope those of you out there that are struggling with this condition, if you've been told it's genetic, I hope this gives you some hope. If you need some strategies, check out my book, Defeat Diabetes. So that's online, it's on Amazon. You can also check out my webinar. So in the link below, we'll put a link to my webinar, which gets into more details in how we approach type 2 diabetes versus conventional medicine and how those two approaches differ. So I'll see you in the next video.